Thank you so much, Sarah, and thanks for that great kind of introduction to the session, and also thanks to the Improvement Service for putting the session on and focusing on domestic abuse. I think it's such a tenacious thing. I'm very aware that I've got 10 minutes and an awful lot to get through in that. So I first of all ask your forgiveness for the gallop that's about to slightly happen. First thing I wanted to say was it's just fantastic to see over 100 people here today, and thank you so much for putting the time aside. I know how tough it is in all of our lives to sit in front of a camera and a screen for yet another period of time, and I think this is just a fantastic day that's been put together by the Improvement Service. So what I'm going to do this morning is just very briefly go through what is the National Trauma Training Programme, what's it about for those of you that don't know who we are and what we do, and what's the rationale for that, and a little bit about the kind of resources that we can offer you to support your journey in becoming trauma-informed or maintaining that trauma-informed practice. And so the first slide that I want to go to is, why do we have a National Trauma Training Programme? What's that all about? And sorry if it's a wee bit hard to see this, but this is the tree from our National Trauma Training Programme. And what it tells us is that the impact of different kinds of trauma in childhood and in adulthood, whether that's domestic abuse or children witnessing domestic abuse or a whole range of different other events, can be really pervasive across the depth and breadth of various different areas. So there isn't just an impact on mental health. There's also, we know from some of the ACEs research and elsewhere, that there's a significant impact of the range of traumatic events and adversity on physical health, on mental health, on social outcomes like education, in relationships, in contact with the justice system, and reduced opportunities in terms of employment and elsewhere. And so we know that as a workforce, it's not just those of us that are working in certain little areas that have got responsibility to respond to the impact of trauma in people. In fact, it's hugely broad across these range of areas. And if you just press next, a little bit of feedback. I wonder if you've got your microphone on, if you could potentially mute that. Thank you. And I think that's probably quite hard to see, but really on the left-hand side, you can see that from our from the 2019 National Survey and Health Survey in Scotland, you can see the prevalence of adverse childhood experiences within the population is relatively high. And down there you can see that physical abuse at 28% and 24% of the population that were surveyed reported having experienced domestic abuse at some point in their lives. And so we know that this is not some kind of rare event, that this is really something that's happening within our society. And the National Trauma Training Programme is about how we make sure that that tree does not reflect the fact that adversity is not destiny. How can we intervene as a workforce to be able to make sure that those experiences of trauma and adversity don't inevitably lead to that range of outcomes? Next slide, please. And I just wanted to say a little bit about what do we mean by trauma and adversity. Well, we've probably all heard a little bit about adverse childhood experiences, but there's a whole range across childhood and adulthood in terms of the different kinds of traumatic events we can experience. And I suppose it's just to say that this isn't a kind of a top trumps, different kinds of trauma don't necessarily trump other kinds of trauma, that this is more subtle than that, that we know that the more trauma somebody experiences and the greater the diversity of the types of trauma that somebody experiences, the more likelihood there is that there are going to be negative outcomes from that. But as I said earlier, trauma and adversity is not destiny, that we all respond in different and unique ways. And if we just go one step ahead, we also know that COVID-19, as Sarah has just said, has brought its own different kinds of traumatic experiences on top of those ones just described. And that's both in terms of for people who've already experienced trauma. The impact of COVID has been, I guess, an exacerbating factor. So one of the phrases that we hear an awful lot at the moment is, yes, we're all in the same storm, but we're not all in the same boat. And we know that people who've previously experienced trauma are experiencing COVID-19 as increasingly distressing and difficult and re-traumatizing. But we also know that COVID-19 is bringing its own acutely traumatic experiences. And one of those is unfortunately the increased prevalence and experience of domestic abuse by women, families and children. And because of social distancing and social isolation, also the supports that we would normally use to be able to help us to recover or to be able to help us to escape are less accessible as a result of the measures coming about from COVID-19. Next slide, please. And so I just wanted to briefly say, what do we actually mean by a trauma-informed nation? And this is a little bit of a blunt slide, but really you'll hear a lot today and elsewhere about trauma-informed. And I wanted to be clear about what we mean by this. We talk about the 6 R's. A trauma-informed nation, it realises the prevalence of trauma. We know that it's more common than we once would have thought, and we recognise the way in which it impacts on people, especially with respect to the barriers it can create if we're not careful as people, as workforces and as organisations, to accessing life chances, to access education, to access housing, to access physical health, for example. And a trauma-informed nation responds with that recognition in mind. So a trauma-informed nation does no harm, it doesn't re-traumatise, it supports recovery, it creates systems that remove potential trauma-related barriers so that we don't design systems that automatically create inequalities for people affected by trauma. In fact, it takes that into account. Can we just press next, please? And so the very important R here is it resists re-traumatization. A trauma-informed nation understands that trauma, the impact of trauma, trauma memories, feelings and responses can be triggered by often subtle or innocuous events or relationships. So in the case of women who've experienced coercive control, that's about any kind of relationship that might feel slightly disempowering, slightly coercive. And we know that as systems, we can often set them up unconsciously where we might hold a little bit more power as those who've designed the systems, and those who are accessing those systems have a little bit less power. Next, please. And so what that means is that we must design systems in which people accessing, whether it be a school, whether it be a dentist, whether it be police, a sense of safety, a sense of choice, a sense of collaboration, a sense of empowerment, and a sense of trust for everybody accessing the services that we offer, so that we are not reiterating the kind of traumatic relationships that the people who've experienced trauma are coming in with, the expectation of relationships. And Opening Doors, one of our animations, is really helpful in, I guess, teasing out what that actually means in practice. We're also very careful that resilience matters, recognising resilience and supporting resilience. Relationships, real relationships really matter. Next, please. And so the aim of the National Trauma Training Programme is a trauma-informed and responsive nation and workforce that's capable of recognising where people are affected by trauma and adversity, that's able to respond in ways that prevent further harm and support recovery and can address inequalities and improve life chances. Next slide, please. How are we going to do that? Well, on the left-hand side, you can see the Transforming Psychological Trauma Knowledge and Skills framework, and that describes 130 pages. You don't need to read it all, but that describes in quite a lot of detail what does everybody need to be able to know and do in order to be able to meet those ambitions. And not everybody needs to be a trauma expert. Not everybody needs to know everything. Next, please. So what we've done is we've divided the workforce into 4 different tiers: informed, skilled, enhanced, and specialist. And that tells us basically what do you as an informed person need to know and be able to do. And that's a relatively limited amount, as opposed to someone who's a trauma specialist who's supporting the recovery of people affected by trauma needs to know much more and be able to do much more. The psychological trauma training plan is really delineating how you as a person identify high quality training. NES is not the only people delivering and developing high quality trauma training. And certainly there's lots and lots of organisations delivering really fantastic training. So if you're delivering training or if you're designing training, the training plan helps you understand what good quality training looks like and how you identify it, and how as an organisation you support people to implement that training in practice. Next slide, please. And this slide just really kind of is a little bit busy, but it tells you a little bit about those tiers. So at the trauma-informed and skilled levels, those are people on the left-hand side. You can say these people don't have an explicit role in the recovery of people affected by trauma. But on the right-hand side, you can see that their role is understanding how the impact of trauma might affect people's responses to you and your organisation, and using that information to make sure you adapt how you work so you do no further harm, so you're not re-traumatizing, and the impact of trauma doesn't create a barrier to accessing your services. And then trauma enhanced and specialist on the left-hand side, you'll see these are the people who've got an explicit role in supporting children or adults affected by trauma to recover, and they offer evidence-based approaches to recognising resilience and supporting recovery, amongst other things. Next slide, please. And so how do we implement that? And I'd encourage you, just because I've got very limited time, to go to this document, which will be widely available after this event, which describes all of the different training resources that the National Trauma Training Programme provides to help you to be able to do that within your tier. Next, please. And that includes animations and filmed workshops. We've got 2 animations, Opening Doors and Sowing Seeds, and we've got workshops that are filmed to go with those as well. We've got 2 e-modules. The backbone e-module is developing your trauma skill practice, and I would encourage really anybody to use that as a way of understanding how trauma impacts people and how you can adapt in line with that to prevent barriers. And then we've got some very carefully filmed, very brief films from a range of different people, including some trauma-informed leaders in Scotland that have been really fantastic. Next slide, please. I'm very aware, so I'm going to skip through this very quickly. So Laura, if you just want to give all 5 drivers, that training is only one thing as organisations, that we need our staff to be able to know and do all of those things in order to be able to create trauma-informed system, but it's necessary but not sufficient. We also need our workforce to be well, and to do that we need our leadership to walk the talk and have a trauma-informed organisation for our workforce as well as people accessing it. And on the other side, we need to make sure that fundamentally we've got collaboration and shared power with people with lived experience of trauma, telling us what they need from our services and telling us whether we're just badging and branding ourselves as trauma-informed or whether in fact they are experiencing it as being trauma-informed. And that's also all about information and data feedback loops from people using our services about their experience of it. Next slide, please. And so that's all I have to say. And just to highlight that, as well as those training resources, we also deliver trauma-informed leaders training to support leaders to create trauma-informed organisations. So thank you very much. That's all that I have to say about the National Trauma Training Programme, and apologies for going a minute over, Sarah.